Hi, my name's Catherine. Today I'm going to be talking about a video on the University of Michigan Aphasia's program website. This video discusses a patient named Chris and how he goes through with his aphasia. So to begin and understand the video, I'm going to start talking about what aphasia is. So aphasia is a language disorder. This language disorder can be broken down into two separate parts, fluent and non-fluent. Fluent aphasia is when you can fully speak a sentence and you can another person can understand the sentence, but what you're saying doesn't make sense. So basically, an example would be, the cat has a bat, is swimming. You can clearly understand what I'm saying, the cat has a bat, is swimming, but that doesn't make any sense whatsoever. Most of the time, patients also aren't aware that what they're saying doesn't make any sense. Non-fluent really occurs when a patient just pulls out the verbs or nouns. So they would say, cat, litter box. And you might be able to understand that the cat is using the litter box if you know that person. But if a person just walked up to you and said that, you would have no idea what they're talking about. So in relation to the video, Chris had talked about how he has a really hard relationship with the peers at his work and his coworkers and his family. And that's because he's not able to really articulate what he's trying to say and really have people understand what he's meaning. So the next thing is, another difference between non-fluent and fluent is that non-fluent is typically correlated with a motor disorder. And that can be with a motor disorder that might be treated in PT, but for the sake of speech, that motor component would also tell us that he has non-fluent aphasia. Now, this is because non-fluent aphasia is affected in the frontal gyrus, which is also a motor section. That motor section also affects speech in another area, the motor speech component, which is apraxia. So because I know that, Chris is only saying those choppy one words, I know that he is non-fluent, but I also can confirm that by knowing that he has apraxia, which he does say later in the video. So the next thing is, how is aphasia caused? Once you know what category it is, what happened before that, what caused it? Typically, aphasia can be caused by a stroke. So strokes can be broken up into two other categories, ischemic and hemorrhagic. Ischemic is just when a blood clot clogs the blood vessel. Hemorrhagic is when the blood vessel ruptures and it bleeds into the brain. So 87% of the time, people have an ischemic stroke. So that ischemic stroke and the hemorrhagic stroke, they both show the same symptoms. They'll have issues on one side, like drooping on one side of the face, reduced movement in one of the arms, difficulty seeing in one eye, extreme headache. All of these things can be seen that lets you know that a person is having a stroke. Then you're probably wondering, okay, so Chris, he has aphasia, he has non-fluent aphasia. He had a stroke, which caused this. What caused the stroke? The strokes aren't, you can't tell. There's no necessarily, there's no pre-warning. You can't be like, okay, you're going to have a stroke on Thursday. Like many things, right? So a stroke is typically caused by a condition that you already have. So this can be high blood pressure, type 2 diabetes, extreme alcohol use, drug use, and age. Typically, these conditions are genetic. You might know somebody in your family who has high blood pressure, therefore you have high blood pressure. But if someone in your family has a stroke, you're not necessarily going to have a stroke. It's just those conditions that can be genetic. So, now we know that aphasia, how it starts. It starts by having a condition which causes a stroke. That stroke then affects an area of the brain. This area of the brain then leads to a form of aphasia, fluent or non-fluent. So overall, the video really just talked about Chris and how he has aphasia, how he has apraxia, that motor speech component, and how he, now talks very slowly and very clearly to stop that choppiness in his speech, and so that he can really pull out all of the words that he's trying to talk about. And that's it. That's all about aphasia. Thank you.